I'm Dr. Anthony. Let me share with you some of the causes of scoliosis. First off, if you look at the spine from the front or the back, it should be straight up and symmetric. If you look at from the side, then you should have 3 curves in your spine. If you lose symmetry from the front to back, or if some of those curves become displaced, that's what we call scoliosis. There's 4 types of scoliosis. You have idiopathic scoliosis. An idiopathic, that basically means that the cause is unknown. Second type is genetic. There's been found to be a genetic link to scoliosis, more predominantly in females. Third type would be trauma. Usually a direct trauma, someone falling and landing directly on their rear. That type of compression trauma can cause a traumatic scoliosis. Then there's a pseudo scoliosis. That occurs with childbirth. The body produces a hormone called relaxin to relax the pelvis to deliver the child, and a lot of times those ligaments in the spine become a little lax, and the spine can lose its symmetry. But after that hormone stops being produced, the spine will restabilize, as does the pelvis, and the scoliosis in most cases will correct itself. Some of the symptoms that come along with scoliosis can be anything from muscle tension. That muscle tension can lead to some restricted mobility with certain ranges of motion, and ultimately you have pain. These symptoms can affect, and most patients tell me it can affect a lot of times their relationships with their spouse, their family, or maybe playing with their children. It can cause them to be a little more irritable or a little less patient. It affects their sleep, can restrict their abilities to work. Also put limitations on their activities of daily living, such as bathing. Things as simple as tying your shoe can become difficult if you have scoliosis that's symptomatic and causing pain. If you're suffering from scoliosis, give us a call. We can help. We can be reached at 215-743-5330.